Today I will be talking about cleft lip and palate. This is my baby brother Eric, and he was born with a cleft lip. Say hi, baby.
Hi.
Cleft lip and palate is not something you usually talk about or bring up in a conversation. However, it is a common congenital facial abnormality that happens in a ratio of 1 in 800 births. When our faces form, the neural tube, which becomes the spinal cord, develops and the face forms in arches as it comes around. But sometimes an error occurs and this leaves for our face to have a cleft, and a cleft is an incomplete fusion of any anatomical structure, which in the face it leads cleft lip with either one-sided, which is called a unilateral, both sides, which could be bilateral, or it could just be incomplete, or a complete cleft lip, or a complete cleft lip and palate, which means the palate is also missing. Moving right along, according to chop.edu, treatment, surgical repair, cleft lip and palate. The baby's lifestyle right after birth, they go through so much. They go from one surgery to another, to another, to another, and to other different procedures. After birth, I recall my baby brother went through surgeries at 3 months, 6 months, a year, and he had some procedures during the way. According to this website, they go through procedures and surgeries. They go through some procedures. It's called the nasal-velar molding, the cleft lip repair, cleft palate repair, palatal expansion, alveolar bone graft and fistula repair, tip rhinoplasty, phase 1 orthodontics, which I'm pretty sure means the teeth, phase 2 orthodontics, orthodontic surgery, which is jaw surgery, and probably some final touch-up surgery, and any other procedure that is probably needed depending on the person or whatsoever that they are going through, or additional health related. In conclusion, with this in mind, today we learned about what it is to have a cleft lip, which is an anatomical error procedure that was not completed right, and it has 4 types. It has the unilateral, bilateral, incomplete, complete, and complete lip and palate types. They're different. They're all not the same. They all have different procedures, but the procedures and surgeries are almost the same.